improve economic productivity, and allowing people to spend some of their savings on education, which improves economic productivity. So all of these factors have been key elements in the huge growth in some of the Asian tigers, and in every country that has gone from developing to developed status since World War II next. And of course, water is a big issue here in India and in many countries of the world, because water is what drives food production along with energy sources. And the water table here in India is sinking rapidly as it's being overpumped for the use of irrigation of crops. Lester Brown issued a paper last week in which he calculated that 190 million people in India are being kept alive through unsustainable overpumping of underground aquifers. And when those waters run out, those people will face a very serious crisis next. And of course, climate change is a big factor. Most climate conferences do not talk about population as a factor, but indeed the median projection for net growth of the world's population from now to 2050, an additional roughly 2.5 million people, even though they're in the lowest per capita emission countries, is the climate equivalent of adding 2 United States to the planet, so it's not insignificant. Clearly, a lot has to be done to reduce consumption and emissions in the West, but ignoring the population factor when it comes to climate issues is clearly a mistake. Next. On the front of family planning globally, there's been a huge amount of progress, as there has been here in India. We've gone from 10% of the world's couples using modern methods of contraception in 1960 to 56% today. But the non-users, the 44% non-users of today, outnumber the 90% non-users from 1960 because of population growth. So we have an even bigger hill to climb with regard to family planning services than we've done since 1960 in terms of the total number of people that need services. In addition to that, next, the primary reasons given for non-use of contraception have changed. In 1960, people didn't know it existed, they didn't have access to it. Now, most people can identify a source of contraception. They've heard of it, they know where it's available, and the non-users are not using it, even those who don't want another pregnancy, for reasons related to fear of health effects, male opposition, religious opposition, and fatalism, the belief that it won't make any difference what they do because God determines how many children they're going to have. So those issues, plus those who want additional children, are what's driving current population growth next. Now I'm going to give you a set of graphs from Africa that just illustrate what I've just said. I could also give you the same set of graphs from Asia. We've analyzed the reasons given for non-use of contraception by people in all 95 countries where demographic and health surveys have been carried out. Each bar represents an African country. It's not important which is which. Just you can see these very small bars represent answers related to lack of access as the reason for non-use of contraception. Next. This is fear of side effects. Next. This is health concerns. Next. This is not knowing a method. Next. This is religious opposition. Next. And this is spousal opposition. You can see these cultural and informational barriers are far more important numerically than lack of access to services. And yet much of the world effort is going into additional services. Not that that's unimportant, but what has been critically neglected has been the informational and cultural barriers. Next. So I started Population Media Center in 1998 to address these issues. We've next gotten beyond population and reproductive health issues. Next. and address an array of related issues, including environmental preservation, child protection, gender equality, and HIV/AIDS prevention. So we're dealing with an array of issues that in many ways interrelate with each other through primarily entertainment media mix. These are the 47 countries in which we have carried out programs to date. The reason I'm here in India is to look into doing a program that may become a successor to a program you will undoubtedly have heard of, Hum Load and Hum Rahi and Tinka Tinka Soup, the three serialized dramas with which we've had involvement here in the past. Next. The person who created the methodology we used is a Mexican telenovela producer named Miguel Sabito. Telenovela means television novel in Spanish, and these are different from American soap operas in that they don't try to go on forever. But they're very similar in that they are serialized melodramas. They tend to last 200 or so episodes. They are the dominant format in Latin America. And Sabito, as head of research of Televisa, Mexico's largest network, in addition to being a primary producer of these serialized dramas, was very aware that he was influencing the audience in numerous ways. And in the 1970s, he began to look at how systematically to promote social development in India using the soap operas. And the first program he did using this methodology was a program called Ven Conmigo, which had a subplot related to illiteracy. And the illiterate adults who populated that storyline were suffering from poverty and unemployment. The negative characters one finds in all melodramas were telling them that they were too old and too stupid to learn, and they should stick with what they had in life. The positive characters were saying, no, you have the ability to learn to read and write, you're smart, you really ought to attend the adult education program of the government. And one by one, these characters decided to do so. They went through the classes, they got their diplomas, they got better jobs, and their lives improved. This program had 1/3 of the nation's viewers watching it, so it was a huge hit, including a huge illiterate television viewership. The year before this program was broadcast, the Ministry or Department of Public Education had registered 99,000 people in their literacy classes through running public service announcements. The day after Sabito's most popular character got his diploma, and Sabito ran an epilogue after that episode in which somebody read aloud the addresses of registration sites in Mexico, 250,000 people came to register in a single day, compared to 99,000 the preceding year. And for the remaining weeks of the serial, he continued to run this ad following the episode in which they gave the addresses of registration sites. And by the time the program ended, 840,000 people had signed up for adult education. Then he did a program called Acompañame, dealing with family planning. But it wasn't about family planning, it was really about family harmony, because he realized family planning inherently is a boring subject. It's a means to other ends, and he wanted to focus on what those ends were, and he chose family harmony. Marta and Jesus, the leading couple, were struggling to keep their marriage together. One of the issues was how many children they would have. And ultimately, family planning became a solution to that problem. And it led to a dramatic increase in clinic attendance and in sale of contraceptives in pharmacies. And David Poindexter, at the time, was a colleague of mine at the Population Institute, discovered Sabito doing this work and came back and reported on a Mexican soap opera producer doing a family planning soap opera. And I thought, that's the most ridiculous thing I've ever heard of. Who could possibly take a soap opera seriously? And indeed, that's the first reaction of some people to our work today. But indeed, what happened, and this was partly the result of David's intervention with the owner of Televisa, Sabito was allowed to do 5 such programs, and while those programs were on the air, Mexico had the most dramatic decline in fertility rates of any developing country in the 20th century up until that time. Next. One of his innovations was to create a middle-of-the-road character who transitioned over time under the conflicting advice of the positive and negative characters one finds in all melodramas. And these transitional characters are designed to become identification characters to the audience. And we find with our own programs that we're getting letters and text messages from audience members telling us they've named their children after some character. And when you have that kind of bond between an audience member and a character, that character has much more influence than the minister of health. Next. So, one of the key aspects that makes this approach effective is that it's long running. If India could solve all of its health and social concern problems with public service announcements, it would already have the health indicators of Norway by now. And people continue to think they can do short-term interventions and solve some major problem, but in fact, intellectual information is notoriously ineffective at changing behavior unless somebody's already looking for that information. So a long-running entertainment program with a lot of suspense can attract this huge audience and allow time for them to form bonds with the characters, and then allow for gradual enough evolution of that character that it doesn't lead to backlash and indeed leads to meaningful change. The entertainment and emotional content of these programs is very important. How many people in this room remember what they were doing when they learned the news of the attack September 11, 2001 in New York? Do you remember that day? And you probably remember it fairly clearly. I remember it very clearly because I flew to New York that day and witnessed what happened. So that kind of event is seared into people remember clearly what they were doing on July 5th of 2001. What that says is, and a psychologist can tell you this, emotional involvement is necessary for memory. If it's boring information, you'll forget it very quickly. But if you're emotionally involved, you can retain it for a lifetime. And I can talk to Indians that I meet in the U.S. who were watching TV in the 1980s, and they can still to this day tell me chapter by chapter what happened to the characters in Home Alone. Next. There's a whole theoretical framework behind the work of Sabito. One of the key theoreticians that he consulted with is Albert Bandura, a Stanford psychologist who has studied how role models influence behavior. Another is Paul MacLean, a brain scientist who studied the locations in the human brain of intellectual, emotional, and instinctive functions, and who found in his work that most values and related behaviors are not based from the intellectual part of the brain, but in the emotional part of the brain. Sabito also has written a book on nonverbal communication, things like tone of voice, facial expressions, body language that convey messages, and this whole tonal theory is a part of Sabito's design framework. Next. We do extensive research related to all the programs that we do that are used to help inform the writers of the situations of people they're trying to reach. And all of this concept and strategy and theoretical framework is described in a book on our website that was funded by UNFPA. It's a free download, so it's available if you're interested in reading more. Next. I'm going to give you just two examples of programs that we've done and their results. Our first of now 8 serialized dramas in Radio Ethiopia was an Amharic language program of 257 episodes. Simultaneously, we did a Oromipa language program, second most common language in Ethiopia, of 140 episodes, which drew about 25% of the population. But the Amharic language program drew 46% of the population. So between the two, we had over half the population of Ethiopia as regular listeners to these serial dramas. Next. We had 48 clinics conduct 14,400 exit interviews with clients. They found that 63% of these reproductive health clients were listening to programs and 18% of the clients named the programs as the primary reason they had decided to come to the clinic. Next. This graph shows the left-hand bar is the day clients, but the middle bar is non-listeners, the right-hand bar is listeners, with regard to the question of have you ever used the method of family planning. See, there were increases among both listeners and non-listeners, but the increase among listeners is more than double the increase among non-listeners. Next. This graph shows declines in not knowing how to determine their HIV status. You see it's particularly prominent among listeners. Next. And this graph shows reported seeking of an HIV test. Male listeners reported going for an HIV test at 4 times the rate of non-listeners. Female listeners reported going for a test at 3 times the rate of non-listeners. And we ran multivariate controls to factor out income, education, place of residence, and religion, and found that a listener was twice as likely to have been tested as a non-listener after running those controls. Next. In Nigeria, it's not uncommon in northern Nigeria for girls to be sold into marriage at 9 and 10 years old. And as a result, they're getting pregnant at 12 and 13. They're physically too immature to be delivering, but they often have, as a result of being physically mature, obstructive labor that can go on for days. And if labor goes on too long, it kills so much tissue that it can leave the woman incontinent. It's a condition called obstetric fistula. And because women have very low status in Nigerian society and they're in polygamous marriages with older men, often when they become incontinent, they are thrown out on the street and live as beggars. And there are 800,000 women with unrepaired fistula in Nigeria. The Rotary Clubs of Nigeria decided to build a surgical center in Zaria and asked us to do a radio soap opera to make women with this condition aware that they should get it repaired. We did that, and we also promoted family planning use and delaying marriage until adulthood. As you can see here, desired family size in Nigeria is even higher than their fertility rate of 5.7. So, and the reasons for non-use of contraception, other than wanting more children, are opposition to the practice and fear of health effects, and not knowing the method, and lack of access and cost are immaterial at less than 1% each. Next. So anyway, this is the program I was telling you about that addressed obstetric fistula through a character named Conde who developed fistula at 15 and then had it repaired at the surgical center in Zaria. And the surgical center asked new clients to identify what had motivated them to come in. 54% of them named this program. At the same time, 33% of family planning clients identified the program as the motivation to come to the clinic. Next. Then with Packard Foundation support, with Packard has provided supplementary funds for the first program, we did a 208-episode, twice-a-week program in 4 northern Nigerian states, Kano, Kaduna, Katsina, and Sokoto. And the N-Line survey, and this focused more on family planning, the N-Line survey found 72% of the population said they had listened at least weekly to this program. And at 11 clinics that asked clients adopting family planning why they had come to the clinic, by the 4th round of monitoring, 67% of the clients named the program as the source of motivation. And we then calculated the cost per person who had adopted family planning and attributed to the program of the entire production of primetime airtime across 4 states and all the research, and it came out to less than $1, 89 cents US. Next. We've done an electronic game of 13 episodes for people who like football, or what we call soccer in the U.S. You can play football with Samuel Eto'o online. He happens to be the public spokesperson for this game, but there's also a character in the game. And the game has narrative events as well as the entertainment part of playing the game, where the player has to make decisions particularly having to do with treatment of girls and in some cases women, and the decisions they make actually determine how well they do in the game. So it's a very interesting concept to use another entertainment format. This game can be played at breakawaygame.com. The name of the game is Breakaway. And the UN Secretary General, after seeing this game, declared it part of the Unite campaign to end violence against women. Next. We work closely with TV Globo in Brazil on the social content of their programs. We've done a program in Jamaica dealing with teen pregnancy issues that the Minister of Education then made copies of all the episodes and distributed them to all the schools in Jamaica. Next. In Mexico, we've done two series of programs. One is 5 state-level radio serial dramas that we did in partnership with an organization called CORA, the Adolescent Orientation Center. And then last year, we co-produced a 70-episode television serial drama called Ultimo Año, co-produced that with MTV Latin America. It played in Mexico and 17 other Latin American countries. It dealt with teen pregnancy and sexually transmitted infection issues. It became the #2 show among women 15 to 24. It was sold commercially by MTV earlier this year and rebroadcast in all 18 countries, as well as being broadcast on MTV Trace, which is MTV's Spanish language channel in the U.S. What is that next country? Philippines. Oh, we've done one program primarily addressing gender-based violence in the Philippines, and I'll be in the Philippines again in January exploring development of a new program. Next. In Vietnam, we've worked with the Voice of Vietnam on 2 programs, one addressing HIV/AIDS prevention and the other addressing climate change adaptation. In West Africa, we did a program addressing child trafficking and child slavery that was very effective at alerting parents as well as young people not to go off and seek their fortune through a trafficker, because many of these people promise them wonderful jobs and they end up working as literally as slaves. Next. Thank you. In Mali, we've done a program dealing with reproductive health. Thank you. It's hard to see it from this angle. In Sierra Leone, we are on the air with a program now that's funded by UNFPA addressing reproductive health and family planning issues. Next. Thank you. In Rwanda, we did a 312-episode radio drama that we broadcast on a private FM called Contact FM. Contact FM has a fairly limited network, but we could not afford the airtime charges of Radio Rwanda, so we went ahead and broadcast it on Contact FM. 24% of women seeking antiretrovirals to prevent mother-to-child transmission named our program as the reason they had come. The program also had an environmental protection theme. 11% of tree seedling buyers cited the reforestation storyline as the reason they were buying tree seedlings. So with that data, we went back to the donors and now have it in reruns on Radio Rwanda, and it has at least 4 times the audience that it did when it was original broadcast. And it will be completed by next year, and we'll see what the impact is. Sudan, we did a program addressing primarily FGM, female genital mutilation. Next. In Niger, we've done one program addressing child trafficking that was highly effective, and now we've been invited to develop a program addressing child marriage. In Senegal, we've done 2 programs in different parts of the country with USAID and UNFPA support addressing reproductive health issues. In Hollywood, we've done 2 briefings to the Academy of Television Arts and Sciences and also the Writers Guild of America, and then we had the audacity as a small NGO to produce our own TV show. And at first I said this is a hopeless place to try to compete because we're very small and these are very big budget operations. But we had a donor who kept insisting we really need something like this to address teen pregnancy and related issues in the U.S. So we did a program called East Los High, filmed in East Los Angeles, about the lives of Hispanic teens, dealing with primarily teen pregnancy and obesity issues, and also sexually transmitted infections, and also addressed the abortion issue. And we had, by the time it was done, 8 networks expressed interest in it, including MTV. We chose an online network called Hulu, H-U-L-U. It's at HULU.com, and it became the #1 show this year on Hulu Latino. So, and Hulu has 30 million viewers, so it's gotten a lot of national attention from Hollywood Reporter, National Public Radio, Los Angeles Times, and other media, and Hulu has now asked us to do seasons 2 and 3. So this has been a great success, and I can show you a short clip from it. Next, and this is where I spend most of my time in developing new projects. I was just in China the last 2 weeks. We're looking into doing a TV program there that will, among other things, attempt to reduce demand for ivory by Chinese consumers and also to address gender issues. And we're here to explore doing a number of things, which I won't go into, but among them is the serialized drama. And with that, I thank you very much. Now, should I show this clip before we stop? Do we have time? Okay, so if you can close this, there's a clip on that desktop. Yeah, just close that whole thing. Now, you'll need sound. This is part of the MTV co-production we did in Mexico. It's in Spanish with English subtitles, and this is a sex education classroom scene. Can you hear sound from that laptop? Oh, now you can hear.
Para hacer chistes, para escribir análisis. Lo más importante es la propaganda.
Now, what I would do, since it's probably impossible to read this, is move it fast forward to about a third of the way through. That's it, right there. And this is the bedroom scene in which the couple is talking about getting tested and seeking ultimately to start using family planning. So, you know, in the West we see a lot of bedroom scenes on TV, but very seldom do they show any discussion of protection. So this was somewhat revolutionary, particularly in Latin America. Now, if you move it right to the middle of the screen, now just a little further. When this scene ends, you'll see some clips from our Hollywood program, East Los High. You can put this whole screen if you want. Lower right corner.
And winner queen are Jacob Aguilar and Vanessa de la Cruz. So are you? Let's cheat on half the girls in school, one and a half 50 cents. He said that's not me. How about that? Yeah.
I better not catch you beating that little stupid Mr. Luther. Really? Except his tongue by the joke, take his flesh.
Smart. But she's my husband. She's not the girl who's home. Go to work. You get that done.
Listen, you meet my brother. Maya is Jacob.
What is up with Maya?
You lost my boyfriend and my friend. Remember that girl you danced with?
I'll have her in no time. What's in it for you?
Not bad.
Hey, Nico, you got a new passport. Hey, this is my son, Jacob.
You made it?
Of course I did.
This is really good.
How's my cousin doing? We all work together. We got to work out. Why are you going to go in every? You have to go. Not look more around. What the hell's going on?
And now, little time.
Hey, I'm going to put you back. Come on. She's so much better than me. Where are her feet, Jake? I have a boyfriend. This is not gossip. This is journalism.
Now, you may think this is rather explicit, but indeed, online and even cable broadcasting in the U.S. has much racier stuff than this. But this program deals with the consequences of both planned and unplanned sex. So the fact that it became the #1 show on Hulu Latino, which is watched by a large number of Hispanic youth, was really exciting for us. And it just in 1 month of broadcast generated 27,000 people to link from one of these sites, where there are a whole set of sites, Facebook pages of characters and other sites where parts of the narrative are told, over to Planned Parenthood, and most of these were new clients. So it has clearly motivated some behavior change. But this particular show would not be something we would do for India, because every show has to be designed for the cultural realities and taboos of any society. But I wanted to show, just to give you an idea of the kind of thing we've done, and the fact that entertainment education does not have to be boring. It can be very exciting, very stimulating, and yet still have a huge impact. So thank you very much.
Thank you.
Spreadsheet, but maybe